Hey guys, I've got a longer extended video cut for you today on hip arthritis and the kinetic chain. And I've got some of the same footage that I had on my YouTube video, but I've got some added footage as well that I want to include to show you some more techniques and a little different edge to how to work with hip arthritis and how to think about the kinetic chain. But I want to talk more today about the kinetic chain and the psychology behind what happens when something like arthritis shows up in the human body. I'm starting in on the lower back as I did with the video I released on YouTube, and I'm doing this for a couple of reasons. My client's main complaint was hip pain in the front and the side of his hip that he's had for about 10 years because of an injury he sustained while in a karate tournament. So he had been stretching and he believes that he had overstretched the front of his hip, went in to do a lateral kick in karate, and suffered a labral tear in the left hip. So what's going on there is a combination of a strain within the muscles and the tendons of the anterior hip, and then a deeper joint issue that's going to create a lot of guarding around the joint. So the low back is going to be one of the main protectors of this area. Because the low back is responsible for lifting the hips up, it's going to be one of the major players in how he walks or runs or moves, creating a lot more contraction and expending a lot more energy as he moves through his day. So the first work I'm doing here is to address that. I want to sink into the QL and the erectors and all of the connective tissue of the thoracolumbar aponeurosis into both sides of the lower back. I'm starting in on his left side, mainly because if I address the side that is affected first, the psychology of allowing my client to rest and know that I have listened and I've heard and I'm addressing his specific issues is going to help the whole process. So I'm sinking into his left low back because it is his left hip that is affected. There's definitely a lot of tension in the QL through the lower erectors and through the attachment sites of those muscles coming down onto the posterior iliac crest. As they work to hike that hip up, the muscles over the years become compacted and pretty dense. If you think about it this way, my client was affected because of lifting his foot up and kicking into something that then transferred back into his foot, up through his knee, up into his hip, created a torn labrum in his hip joint, and then traveled up into the low back from there. My process on working with him is kind of going in reverse from there. So I am starting off into the low back and then working down through the hip and pulling down through his knee and his foot in the end, allowing him to gain that length back. So following the kinetic chain as it was impacted up, but working therapeutically back down. As you can see here, my intention is to push the hips down away from his torso and then using my left hand purposefully just to connect the parts of his body and integrate the chain into one whole. As I cross over to the other side of the back, I want to emphasize not only the importance of working on both sides to create balance and to create continuity, but I also want to elaborate a little bit more about a technique that I did demo in my YouTube video, but it's one of my favorite techniques and I use it quite a bit, not just for clients who have low back or hip pain, but also if anything is showing up that feels disproportionate from one side to the other. Any work that we do into the low back is essentially at the core of our client's movement, and so to create an awareness of the connection from the right side to the left and from the lower half of the body to the upper half is a key factor in finding balance. For this technique, I'm using the knowledge that the kinetic chain typically works up one leg, crosses through the midsection of the body, and then up to the opposite side through the shoulder and up to the arm. As I'm sinking into my client's low back, I'm asking him to raise up his right leg with his knee straight, just a little bit up off the table, and simultaneously lift his left arm up so that he's pushing his arm towards the wall in front of him. While he's doing this, I'm sinking into the muscles of the low back, and you can feel the contraction of everything surrounding the low spine and the hip area. So even just the simple act of walking engages this path of contraction. The right leg will work congruently with the left arm, and vice versa, the right arm with the left leg. You see this pattern a lot with pain and dysfunction and muscle guarding, and this is especially showing up for my client with the arthritis in his hip. I'm going to repeat the same technique on the opposite side, which is actually the side he is feeling a little more pain, and I'm going to offer a variation of how to do this. So I'm standing on the same side mainly for filming purposes, but as I sink in with my thumbs here, I'm standing in a way such that as he relaxes back down, I'm able to slide my thumbs up the paraspinals as they release that contraction. So it's a little bit like pressing into a rope that is starting to unravel and pushing those threads open towards the end of the rope. So you're kind of thinking about these tightly wound fibers in the lower back, and then as they work up, they're opening up and unraveling, and you're just encouraging that process. Let's talk a little bit about arthritis as I move down into the leg and start to work the hip from this angle. So there are over 100 types of arthritis, and for the most part, what we're really dealing with is joint inflammation. It's important to understand what type of arthritis your client has before starting this work, but one of the common threads that runs throughout anybody who's got arthritis is this sense of inflammation. It shows up a lot with the joints and really can limit joint movement. What's happening here for my client is that he sustained an injury, which I talked about before, the labral tear in the hip, about 10 years ago. And the labrum is considered a kind of a disc. It's a cartilaginous feature that helps soften the impact between the head of the femur and the acetabulum, which creates this ball and socket joint. So it's a little bit like a meniscus in the knee or a disc in between the vertebrae. But the important thing to really understand is that arthritis can become a bone-on-bone issue and oftentimes create a sandpaper-like effect on the articular surfaces of the joint itself. So when that happens, the synovial fluid that lives inside of a joint plays a bigger role on how important fluidity or keeping that joint lubricated can be. But the trick is, once arthritis shows up, the affected person often does not want to move. The movement feels painful and the inclination is to then remain stagnant. But that's most often the worst thing that you can do. Synovial fluid is going to be like a lubricant in the engine of your car, and it's going to allow things to keep moving, and movement itself produces more synovial fluid. Synovial fluid gets absorbed into the cartilage of the synovial joint, and when we move, it's like it's squeezing that synovial fluid out of the cartilage again, kind of like squeezing water out of a sponge and helping that fluid to stay in the joint. So movement, although painful at first, can be one of the bigger factors into joint health in the long run. I hope all of that made sense, and I'm employing it even now in this work that I'm doing with the hamstrings. So as I sink in with my left thumb, I'm using my right hand to rock his leg back and forth into internal and external rotation, and that happens at the hip. So there's a little bit of passive range of motion in that ball and socket joint, as I'm also creating a little softness in the muscle tissue around the joint. So you're getting the production of synovial fluid, and you're also sinking into some muscle fibers that have really been holding and contributing to that stiffness. I'll get into slightly bigger movements of the hip a little bit later on, but for now I want to start to sink into the muscles around the hip itself. So obviously the glutes, the glute max, the glute medius, and sinking into the TFL, which he very specifically complained about pain in the front of the hip. So I want to make sure I address that. I want to start with slower compressions directly into the glutes with a soft fist. And as I'm doing this, I'm just talking to him about visualizing letting go. I think that's incredibly important. I think you guys have heard me say this a number of times, but every once in a while, checking in with your client and asking them to really visualize allowing their hips to drop down to the table, or allowing the fibers of their muscles to unwind, allowing their heels to fall away from each other. Those kind of visualizations can be that extra little thing that maybe hasn't happened yet for them. My client had mentioned earlier that he had overstretched his hip before actually incurring the labral tear. So there's a couple different things at play, like I was talking about earlier. And because of that, the combination of things going on for him has created this pain in the side and in the front of his hip that feels very compacted and feels like it won't move. So one of the things that I'm doing to address this very specifically is to take the ends of the glute medius and try to soften them up with a little friction, but at the same time really crowd the fibers of those muscles so the muscle itself is starting to release that knot and soften so that I can sink into it later on from the side lying position, which I'll do in a little bit. But I want to make sure I'm prepping towards really creating some really effective work. I may have mentioned a few times in a couple other videos how I think that working a muscle from different angles is super advantageous, and this is no exception. So my client is face down, but I'm sinking into the TFL, and I actually think this is a really productive perspective for this muscle. There's lots of great ways to work it from side lying and from supine, but from here, I'm sinking in with my thumbs, and as I'm squatted down, I'm able to kind of sink up with my thumb and use the table as a little bit of leverage. While I'm here, I'm going to employ the movement that I think is so important for his hip, and I'm going to ask him to internally and externally rotate his leg so that we get some of that synovial fluid going, and at the same time I'm activating the TFL. This muscle very specifically does internal rotation, so as I'm asking him to internally rotate, I can feel it contract, and then as he releases his leg back out, I can sink in and create a little more room in the front of his hip. So this can get a little tricky for especially newer massage therapists because internal rotation can look the opposite when the client is prone, but the whole idea is thinking about how the femur is moving inside that ball and socket joint. So if his knee is bent, he's going to let his foot drop in to create a stretch in the TFL, and as he lifts it back up, the TFL is contracting to create that action. And I can use this to my advantage. I can do an active release technique as it is contracting, and I can do a pin and stretch as it's lengthening. I've said it once and I'll say it a million times, knowing your anatomy and knowing how it works is going to be the key to everything you do. I want to come back to the kinetic chain for a minute and just help to emphasize the length I've just created in the front of the hip. So for this technique, I'm going to come down to his ankle and I'm going to create some traction in the leg by hooking into the ankle and leaning back a little bit. As I do this, I'm going to ask him to engage his abdominal muscles. So I'm going to ask him to pull the front of his hip or his pelvis up towards his chest. It may feel a little weird as he's laying face down on the table, but this is going to create a posterior pelvic tilt at the same time that I'm pulling down on his leg. And it's subtle, but it definitely creates a nice long stretch in the front of the hip. It also creates a muscle activation, which sometimes can feel a little foreign, and that can just wake things up and bring a new sense of awareness to an area. As is the nature of the beast of the kinetic chain, when one side of the body is injured or holds dysfunction, the other side is going to compensate. So with that, I'm definitely going to take some time on his right leg and flush it out and make sure the muscles that are typically the more stabilizing muscles are starting to relax a little bit and gain a little bit of relief. When there is an issue like this on one side, so for my client, it is his left hip that is affected, the opposite side, or my client's right leg, is going to do a lot more stabilizing work. So for example, if my client wants to go for a walk, he's got to lift that hip up a little bit higher because he doesn't have the normal stride and the normal range of motion that you get in the swing of the hip. And that right leg has to do the extra stabilization to make that happen. So it's always important to take notice of this stuff. I've often worked on a client with this kind of situation and gone to work on the side that I know has been compensating, and I will often hear my client make a comment about the fact that they had no idea there was that much tension holding in that area. For my client, there was definitely a lot of tension in the hamstrings and the adductors, but his calves and his shins were noticeably overworked from the slight motion of having to grip his toes a little bit more, which has been helpful in creating that stabilization that he's been lacking. If you'll notice, I've got his foot on my left thigh so that as I lunge forward, I'm creating a little dorsiflexion with his foot, which then in turn creates a nice stretch all the way up the back of the calf through the hamstrings up into the hip. So keeping intact the continuity of how one leg affects the other, and of course how one leg reaches up all the way up in through the hips and into the lower back. I'm also doing a little bit of adjustment with the rotation of his foot on my thigh so that with every nuanced movement, his hip sits a little differently and I'm able to access different fibers of the gastrocs and the soleus reaching up into the back of the knee. This is just a more encompassing way to work and a more thorough approach. And to bring it all together, as I pull on his ankle to create some traction in his leg, I'm asking him to simultaneously reach above his head with his left arm, creating a really beautiful cross stretch across the entirety of his body, from his right foot all the way up through his right leg, through his hips, across his low back, and all the way up to his left hand. This is an active connecting stretch that clients really love. One last little tip, because I just can't help myself. If you want to create a little extra length in the calf, I'm using my thigh to give a quick repeated stretch as I work up the calves. It's one last little dig into the calf muscles that I know are really tight for my client, and I just threw it in there. Have you ever noticed how sensitive calves can be? I mean, somebody can take so much work on their back and their thighs and their hamstrings, and then when it comes down to the calves, it is like, forget about it. To loosen up my client's right hip, I'm using my left hand to actually grab the femur, and you can see my fingers kind of sinking in kind of to the lateral aspect of the upper hamstring muscles and sinking down into kind of where the gluteal tuberosity would be. And I've got my left thumb hooked into the greater trochanter, and as I push the femur into external rotation, I'm using my right hand to grab the posterior iliac crest and pull the hips into the opposite direction. So I'm creating a little bit of a twist and, in a sense, loosening this jar that has become really tight around the circumference of his hips in general. So I'm using my hands to create a torque and opening up this side of his holding pattern. At this point, I'm going to drop an elbow into his glutes, and I'm doing this for a couple of reasons. Number one, this is not his affected hip, so I can sink a little deeper. Number two, my hands are a little bit tired at this point, and using an elbow is just a good choice mechanically. I want to talk really quickly about the fact that sometimes when I do these still holding compressions like this, I take the opportunity to really explain what's going on for my client anatomically and physiologically. And I cannot stress enough that this is one of the things that I think clients really, really love. Having a deeper understanding of what's going on for them and the intention of your work is going to help them to allow that work to happen and give them a better understanding of what's going on for them after they leave the session. And this can be, in and of itself, one of the factors that gives you the edge over another massage therapist who might be equally as technical, but just not communicating as well. I'm not saying it's a competition, but it's really nice to have those repeat clients and make that money. I'm about to turn my client onto his side to get into the glute medius, and I want to have you guys listen in to how I talk to him about positioning and movement throughout the work that I did. All right, so Sherman, bend this leg up a little bit more towards your knee, towards your chest. Good. Leave that leg right where it is. Good. I'm going to have you stack your hips a little bit, so roll onto your side a little bit more. Good. Okay. So right in here, actually I'm going to have you take this leg, keep it nice and straight, and lift it up towards the ceiling. Good. And relax it back down. Good. And lift up towards the ceiling. And relax it back down. His glute medius is really strong, so as I'm doing this, my fingers are getting a little bit tired, so I'm going to sink in with my elbow. And the elbow is hard to hold still on the glute medius. So I'm using my hand as a stabilizer, wrapping my fingers around my elbow, and as he does that same technique, lifting his leg up, which activates the glute medius, I'm sinking in with my elbow, and I'm able to dig down a little bit deeper with this muscle. It's really tight on him, so I wanted a lot of power in my work. I'm pushing down on that reverse kinetic chain again and asking him to reach up simultaneously, which is going to open up some space in the QL. And I'm about to do some really cool work into the QL that I want you to listen into again. Ready? Yep. Okay, so into the QL here. All right, Truman. Okay, you're going to take that left knee and bend it up towards your chest. Up, up, up towards your chest. Now bring that knee up towards the ceiling. Up and back down. And then extend it straight again. Push straight, push, 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 push the heel all the way down. Good, and relax. Okay. Stack yourself a little bit. Good. Okay. Right in here. We're going to do that again. So bend your knee up towards your chest. Up, 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 up. Lift your knee up towards the ceiling. Good. And back down. And extend it straight. Good. And relax. Good. Your pressure with this action should be sinking in towards the spine and a little bit anterior, and it addresses every action that the QL does related to the hip. It is such good work. I'm doing some relatively similar work here into the TFL. So I'm taking my right hand and I'm hooking my fingers into the anterior hip and really getting a hold of the TFL. And I'm going to use my left hand to help the pressure. So both hands are doing the work here. I'm going to ask him to kick his knee straight, and as I sink down into the TFL with my fingers, I'm going to get him to turn his knee down towards the floor. This is internal rotation, which is what the TFL does. So as he's internally rotating his hip, I'm sinking into the TFL and creating an active release so that when he relaxes his leg all the way down, I can sink further, and because his hip is in a slightly flexed position, I'm able to really create some space. The anterior hip is tricky to work with and can feel a pinch or an overstretch pretty easily, so I want to create softness, but also the ability to sink deep. And this technique I find does that really well. I want to also emphasize for a moment the position of my left hand, which might appear a little bit unprofessional, but I've got my left thumb on the posterior iliac crest, and I'm using my fingers to guide the humerus into internal rotation. So my boundaries around working anatomically are really clear, and that intention, along with any communication, is super clear for my client. When I'm done, I'm going to connect this work back up into his back. So I'm using my left hand to hook into the anterior hip and pull, while I'm using my right hand to hook into the erectors and push, offering the spine a little bit of a twist. A little more QL work, let's listen in. Here. And Sherman, I'm going to have you take that hip and hook it up towards your shoulder. So show me there, yep, and relax it back down, good, good. So you're not going like this, you're going up and then down, good. All right, so I'm going to resist down here, and I want you to pull that shoulder back. So go ahead and pull, and relax. That's a pretty easy way to activate the QL and then stretch it out. And what I like to do at the end is take the ankle and rotate it in and out, just reinforcing that kinetic chain. I finally got my client on his back, and some of the best work that you can do in the hips is from this position. I'm going to start by lifting his knee up and placing his foot on the table. And once his foot is there, I'm going to actually sit on it so that it doesn't move, and I can start to do some work into the quads, pulling and opening up and creating space in the front of the hip. Arthritis or no arthritis, the front of the hip can get really compacted, and this can be one of the more effective ways to open that joint up. While I'm here, I can also create some activation. So as I hook into his quads and lean back, I'm going to ask him to pull his knee up towards his chest. And as his hip flexors are firing, I'm applying a resistance. And the idea here is just the basic premise that once you fire a muscle and then it relaxes, it has to, by nature, relax beyond its normal state of relaxation. So I'm giving it a couple of activations to help it relax a little bit deeper so that I can move it around and create more space. Okay, I'm going to start to pick up his leg and really move his hip around. And if you've ever worked with anybody who suffers from arthritis, you know this is not an easy thing to do. So I'm going to start with some subtle movements, and I want to really pay attention to what he's telling me, plus his facial expressions as I create movement. The initial movement is okay with my client, and as I hook his foot into my hip, he's starting to elaborate a little bit more about the pinch that he's feeling in the front of his hip. I definitely want to make sure I'm paying attention to this, and I want to move slowly so that his joint and his muscles can translate this movement up to his brain, and he can allow this to happen. Any sudden movement and aggressive techniques are going to just reenact that guarding pattern, and that's the last thing that I want. This part may look like there's nothing going on, but I'm just talking him through really letting his leg go. And sometimes having patience in these moments is more than they offer themselves, so just allowing him the time and the space to really let go on a new level can be really helpful. I want to activate his hip a little bit while he's in this position, and it's hard to see, but I'm asking him to push his foot into my hip, which is going to activate his hip extensors, basically his hamstrings and glutes. And as he does that, I'm engaging resistance, and then when he lets go, I'm just giving a little extra stretch to that hamstring. Obviously, as you can see, these movements are so minor, but an arthritic condition, or really any condition where you've got somebody who's experiencing acute pain, you want to make sure that you're staying within their realm of comfort and making adjustments according to what they can adapt to. While he was here, I also had him grip his toes around my hip. So activating his toe flexors and his plantar flexors, he was able to let go of the hip a little bit more. It just brought his awareness down to his foot and allowed that kinetic chain to reconnect. And that was kind of the whole point of this session. I think that's really cool about body work. Sometimes it can look on the surface like there's nothing going on, but there is so much change happening and you just can't see it. At this point, I'm creating a connection from his left hip to his right hip. So as I let his left knee drop down, I'm using my left hand to pull his right hip up off the table. And I'm moving the hips in unison to create some fluidity in the low back and the pelvis, and just reminding the soft tissue that it doesn't have to be at war with itself. At this point, I want to bring his knee up towards the ceiling. I want to give his adductors a little bit of a rest. And from here, I'm going to rotate his foot in, which is actually external rotation of the hip. But as I do that, he's still feeling that stiffness that comes along with arthritis. And so I want to bring his attention into a different area. And like I mentioned before, he's got a lot of overcompensation patterns in his lower legs. So in this position, I'm asking him to point his toes and then relax them. And that brought his consciousness down to his ankle and his feet, and all the musculature around his hip could let go a little bit more. As I move his leg gently across his body and give him a little more flexion up towards his chest, I want to remind him of the power of his brain over his own soft tissue. There were a lot of moments that it became clear to him that he was guarding really subconsciously, and letting go became an extra effort for him. This is definitely something I see a lot, and clients don't often know the degree to which they are holding on subconsciously. So with these last little moments of traction and movement, just reminding him that he's got a lot of power over his own soft tissue, and movement for him can feel good again. I promise you that with every time I film, I'm learning something new, and with this shot, I wish I had a wider angle. I'm asking him in this moment to reach into a good stretch oppositionally. So as I create traction in the left ankle, I'm asking him to reach up with his right hand, and vice versa. As I create traction with his right ankle, he's reaching up with his left hand. This stretch is great because all of that connectedness can really sink in.
Start over. It's better safe than sorry.
How was I?
You could use some work. No, I'm kidding. Right.
And then you kick with your heel.
Uh-huh.
Right? Yeah. And so when your butt is more pointing up, but in the process, like I guess as
like
I was trying to turn.
Just kidding. Go ahead.
Could you shrink about 6
right?
inches?
Seriously tall. Game of Thrones, take 55.
Just
I
know
want to be
that
on the
means
show.
take 3.
I want to be on the show. That's just all I'm saying.